Welcome to the section on fraud, waste, abuse, and error. As you can see, we will be working with a booklet from the Medicare Learning Network. It's quite a long document, so we won't have time to cover all of it, but we are going to cover the pertinent parts of fraud, waste, abuse, and error. Few things to consider here is that the Office of the Inspector General under the Department of Health and Human Services does have a hotline which accepts tips and complaints from all sources. This can be patients, it can be claims representatives, it can be anyone in the office. And there are several different instructional videos on the hotline operations as well as how to report to the OIG. What you should notice here is that Medicare plays a very big role in fraud and abuse investigation. What we're going to look at in this particular program is some examples of fraud and abuse, and additionally some of the laws and some of the agencies which help fight fraud and abuse, and hopefully identify the differences between fraud, waste, abuse, and error. So let's define fraud first. Medicare fraud is knowingly submitting or causing to be submitted false claims or making misrepresentations of fact to obtain federal health care payment for which no entitlement would otherwise exist. It is also soliciting, receiving, offering, and or paying remuneration, also known as money, to induce or reward referrals for items or services reimbursed by federal health care programs. And lastly, making prohibited referrals for certain designated health services. Some examples that you see here are billing Medicare for appointments that a patient failed to keep, billing for services at a higher level than actually provided or documented in the file. We call this upcoding as well. Knowingly billing for services not furnished, supplies not provided, or both. And lastly, paying for referrals of federal health care program beneficiaries. Note, defrauding the federal government and its programs is illegal. Committing Medicare fraud exposes individuals or entities to potential criminal and civil liability and may lead to imprisonment, fines, and penalties. Remember that Medicare is a federal agency. So anything you do to Medicare and also Medicaid, you're doing to a federal agency. Medicare abuse is slightly different. Abuse is a term that describes practices that either directly or indirectly result in unnecessary costs to the Medicare program. So these are any practice inconsistent with providing medically necessary services meeting recognized standards. And examples here are billing for unnecessary medical services, charging excessively for services or supplies, and misusing codes on a claim such as upcoding or unbundling. There is a little bit of gray area with upcoding as to whether it is fraud or abuse. But either way, you want to avoid it. This table explains the differences in errors, waste, abuse, and fraud. They all result in improper payments. Please remember this is purely educational and is not an exhaustive list. If you're uncertain about your coding or if something is inappropriate, you need to ask the question. So, starting here, mistakes are errors. This is incorrect coding or submitting a claim with incorrect birth dates. Generally, if the claim is made, for example, with an incorrect modifier for something that was done on the left eyelid instead of the right eyelid, this is an error. It can be corrected. Wastes are considered inefficiencies, like ordering excessive diagnostic tests or requiring a name brand medication rather than a suitable generic. And again, we get to abuse and fraud. Abuse is bending the rules, and they're talking about improper billing practices like upcoding. And then fraud, which is intentional deception, billing for services not supplied or not rendered. This very useful document goes on to talk about the fraud and abuse laws, giving you access to them, including the anti-kickback statutes, the Stark laws, criminal healthcare fraud statutes, and then additional fraud and abuse penalties under Medicare. There's an interesting exclusion statute with Medicare and the OIG that essentially excludes a provider from participating in federal healthcare programs if they are convicted of Medicare fraud, patient abuse or neglect, or any felony convictions related to those things, including unlawful manufacture, distribution, prescription, or dispensing of controlled substances. So if Medicare catches you doing these things, you cannot participate in any federal health care programs. Something you also need to be aware of is that many commercial carriers will follow similar exclusion principles because they have contracts with Medicare and Medicaid. And very often in physician credentialing, the physician will have to certify that no one under his or her employ or his or her supervision has been convicted of any of these types of fraud as well. Thank you for attending this lecture. I hope that you will take a look at the rest of this document when you have a moment. It's very useful and appropriate piece of information for determining fraud, waste, abuse, and error.